health and health system indicators, including COVID-19 positive hospitalizations and ICU patients. And the number of outbreaks in long-term care and hospitals continues to decline, as does the number of active resident cases in long-term care. The percent positivity of tests has remained stable this week at 12.4%, and most of the wastewater sites across the province are reporting either stable or a downward trend. While overall we have seen improvement, there is some regional variation, primarily in the north part of the province. We will continue to monitor this situation closely and provide our assistance and support as needed. Once again, I want to thank Ontarians for their incredible sacrifices. These collective efforts have allowed us to get to where we are today. On Tuesday, March 1st, we intend to continue our cautious, phased, and staged reopening of the province by lifting capacity limits in all remaining indoor public settings. And proof of vaccination will no longer be required from patrons in certain businesses. Mardi, le 1er mars, nous prévoyons poursuivre la réouverture prudente par phase ou étape de la province en éliminant les limites de capacité établies pour l'intérieur de tous les endroits publics encore touchés. Et la preuve de vaccination des clients dans certaines entreprises ne sera plus nécessaire. As we proceed with the reopening of the province, it is important to note that this virus is still with us and will remain with us for some time. COVID-19 remains a global challenge, but we know what works. We have tools that we did not have just 2 years ago, including highly effective vaccines that have changed the course of the pandemic, high vaccination rates that continue to improve as more and more Ontarians see the value of getting boosted to protect themselves, their families, and their communities. Ever-increasing supplies of effective treatments for those at risk of getting very sick, treatments that mitigate the risk of severe outcomes of COVID-19 and significantly reduce the risk of hospitalization. 2 years of experience on how to best protect vulnerable settings, such as retirement homes, long-term care homes, as well as how to mitigate spread in school and other education settings. We will continue to closely monitor for new variants that may bring new challenges, and we will use the knowledge and experience we have on how this virus behaves and what works to stop its transmission. Masking requirements will remain in place for the time being, but we are reviewing these measures and hope to provide an update in the coming weeks. Le port du masque demeurera nécessaire pour le moment, mais une révision de ces mesures est en cours et nous vous informerons des derniers développements au cours des prochaines semaines. Masking does remain an important tool in our toolbox, and even when it's no longer required in public settings, it will continue to be an effective tool for reducing transmission and protecting those recovering from illness, their close contacts, and those who may be more vulnerable to severe COVID-19 infection. Some in our communities may also choose to continue wearing them regularly, and we need to be respectful of individual choices once masking is no longer required. Given the positive trends in the public health indicators and the high vaccination rate, we are actively reviewing all directives and instructions to healthcare providers or organizations that were temporarily put in place in response to the COVID-19 pandemic. Étant donné les tendances positives des indicateurs de santé publique et les taux de vaccination élevés en Ontario, nous examinons la possibilité de réviser toutes les directives et instructions données aux fournisseurs de soins et aux organismes de santé qui ont été temporairement mises en place en réponse de la pandémie de COVID-19. The eventual lifting of these directives and instructions reflects a move toward regular operations that will continue to ensure staff, students, clients, residents, and patients are protected. Keeping these important groups safe will be in part done through recommendations and guidance from my office, including for prevention, infection prevention and control. I know that I signaled my hope that we may be able to do so by March 1st, in alignment with the next steps of the province's reopening, but it may take a little longer as we continue to work with the relevant sectors to ensure that there are no gaps in guidance as we look to lift these measures in the near future. Rest assured, this work is underway and will be communicated with sector partners and the public when it's ready. Vaccination has been a key component of our COVID-19 response and continues to be the most effective tool to reduce the risk of hospitalization and death. It is important that healthcare workers get their first, second, and third doses if they have not already done so. In the face of the Omicron threat, we are fortunate that our vaccination rollout continues to be strong, and as of February 23rd, 85.2% of Ontario's total population has received at least one dose, 81.3% have received 2 doses, and 47% have received 3 doses. Especially pleased to see that we expanded eligibility to youth on February 18th, and 6.2% of those 12 to 17-year-olds have come forward to get their booster doses. Boosters are an effective means of reducing your likelihood of becoming seriously ill from COVID-19, and there's good evidence that vaccination cuts your risk of developing long COVID syndrome in half. Les doses de rappel sont une moyenne efficace de réduire votre risque de tomber gravement malade de la COVID-19 et des éléments probants ont été recueillis indiquant que la vaccination coupe de moitié vos risques de développer le syndrome post-COVID-19. Even if you have had COVID in the past, getting vaccinated is still recommended as it provides better protection against future infection. Once again, I want to thank Ontarians for their incredible sacrifices. While the risk remains, and we must remain nimble in our response and be ready to respond to these new risks, it is clear that we're coming out of this wave of Omicron and that the coming months, as we move into spring and summer, will provide some needed relief. Thank you. Merci.
We'll go to the phone lines for questions. Just a reminder, it's one question, one follow-up. Over to the first question, please.
From Antonella Artuso, the Toronto Sun.
Good afternoon, Dr. Moore. Are you likely to remove all masking orders at the same time, or do you anticipate phasing them out? And if so, where would school children be on that timetable?
So the consultations have started, and we will be working with school boards, with parents, with the ministries, and make a decision together. But we do anticipate if we remove it in the public sector, we would do it simultaneously for the schools. That would seem to align as the risk decreases to do them together.
Follow up. Antonella?
Follow up? Sorry. Do you have any recommendations for March break? Is it okay to go away now?
So certainly the federal government continues to advise Ontarians that there is an ongoing risk, but that risk can be mitigated by taking appropriate precautions, by having been vaccinated, by testing upon return, and following masking, distancing in the environment where you're going to be traveling to. So I think the risk is decreasing day by day. I think any family should do a risk assessment of where they're going to, what the risk of the virus is in that setting, and certainly take into consideration if they've got any underlying medical illnesses, and potentially consult with their healthcare provider if they do. But otherwise, the risk has been decreasing week by week across North America, and I would encourage Ontarians, if they've taken advantage of immunization and follow the basic principles, to enjoy March break as best they can.
Next question.
From Alison Jones at the Canadian Press.
Hi, Dr. Moore. I'm wondering if among all of these things that you're reviewing, I wonder if isolation rules are included in that. Are you looking at changing or rescinding all of the rules that were brought in at the height of the Omicron wave in terms of, what symptomatic people have to do, what people have to do if someone in their household has symptoms, for example?
Yeah, thank you very much, Alison. That is absolutely on our agenda. We want to review those requirements at present and ensure that they reflect the risk and are balanced and proportionate to the risk. We know and thank so many Ontarians that have stayed home once they've been a high-risk contact or once they've had the disease, so they've minimized the spread. But in light of high vaccination rates, effective therapeutics, and the diminishing risk week by week across Ontario, all of those protocols have to be reviewed. So our team is actively consulting with local public health agencies, with Public Health Ontario, which provides scientific guidance to us on how we can cautiously, slowly remove any isolation or quarantine requirements, but it has to be proportionate to the risk and when we're in a safer time frame.
Follow-up?
Yes, thank you. You said that you wanted to end workplace vaccine policies. You said it might take a little bit longer than March 1st, but the long-term care minister says the vaccine mandate for workers in that sector is being reviewed. I know you previously said that you don't have the power to revoke that one, but in your opinion, as the province's top doctor, do you think that mandate should stay in place for a while longer, given how vulnerable that population is?
Well, I have to celebrate how well we've done in the long-term care sector, both from an immunization rate for the patients or clients that live in that environment. We were one of the first to have a third dose strategy in August of 2022, one of the first in North America to have a fourth dose strategy for clients in that environment. And the workers have stepped up. They've gotten their first, second, and a vast majority have gotten their third dose. So at this point, I'm absolutely supportive of working with the minister to reflect on their current rate of vaccination and the risk in the community and review whether that mandate of a third dose in workers should be maintained.
Next question.
From Charlie Pinkerton at Queen's Park Briefing.
Hi, Dr. Moore. My first question is about some newer vaccines against COVID-19 and newer to us here in Canada. That of Novavax and Medicago's, which I believe the latter of which was approved today. A couple months ago, you were speaking about Novavax's vaccine, and you shared an opinion with other experts I've heard that because of the technology it's based on, it's a more, familiar vaccine to some people, unlike those of which are based on mRNA technology. Do you think the province should reach out to the federal government to try to acquire doses of these vaccines, or has Ontario sort of gotten as far as it will in terms of its effort to vaccinate as many people as possible with vaccines it's already received?
Oh, thanks so much, Tony. So we're actually very excited about both the Novavax and the Medicago products. They are proving to be highly safe, highly effective. They are more of a traditional vaccine, and that may have appeal to the 10% or so of 12-plus population that haven't received a vaccine as of yet. So we are working with the federal government to get, I would believe, Novavax will be the first product available. It should be available second or third week of March in Ontario, and we'll communicate that directly to all Ontarians. I hope that the 10% of Ontarians adults 12 and up would reflect and review this product with their healthcare provider and see if it's right for them. It is highly effective against multiple strains of COVID, including Omicron, and we think it'll be available in significant amounts the second and third week of March. The Medicago product, we have heard just recently that its delivery to Ontarians may be delayed several months. So we may not hear of its availability confirmed till maybe May or June. So of all the products available, Novavax to me is still exciting. It's a traditional vaccine where the recombinant protein is being injected. That's how most other vaccines work, like influenza. You'll build antibodies against it, and then your immunity, both cell-based and antibody-based, will continue. It's 2-dose vaccine at present, and I think it's a great alternative for those that didn't want an mRNA vaccine. That it is more of a traditional technology, and I hope it does appeal to some who have yet taken advantage of our vaccination strategy.
Follow up.
Okay, great. Thanks. Thanks for that thorough answer. Once the Health Ministry directive regarding vaccination policies for hospital employees is lifted, is it going to be your advice that it would be a greater benefit for hospitals to rehire nurses who lost their jobs because they didn't meet their hospital's vaccination policy? Or, would it be better for these nurses to not be rehired because of the additional risk that they would still continue to pose?
So thanks for that question. I just have to be clear. Directives from the CMWH office are meant to be time limited, and they are to be an immediate risk to the health of the population. And so we are forced to review any directive that's in place, given that we're at a different phase of the pandemic, and the risk is decreasing day by day. So it is always necessary for me to review all directives that are written by the Chief Medical Officer of Health. So I don't want anyone listening to say I don't endorse immunization of healthcare workers or policies to immunize healthcare workers. What we're asking now is if the directive has to be removed, we're asking all of our healthcare partners to reflect on their current policies. I would suggest they do adopt an immunization policy for new hires, especially, and or for those that were let go, and that the corporations that have let any individuals go have to reflect on their policy. But we won't be prescriptive in any way. I absolutely 100% endorse anyone providing care to a vulnerable member of our community to be immunized.
Last question, unless someone else joins the queue.
From Jeff Gray at the Globe and Mail.
Oh, hi, thanks. I just wanted to ask about the mask policies that you're looking at lifting. You mentioned lifting them all simultaneously as the goal, but would there still be holdover mask mandates or mask policies for, say, hospitals or long-term care or maybe even public transit? Is that something you'd consider?
Thanks very much, Jeff. I would absolutely want to reflect that high-risk settings, such as public transit, such as hospitals and long-term care, would maintain a masking policy beyond when we appeal it for general indoor settings for Ontarians. So the highest risk settings, I think we've learned that the masks have benefit. They reduce the risk of spread of multiple different pathogens, not just COVID, and have provided a safety net that is necessary in those high-risk settings to so many vulnerable patients and populations. So we will be reflecting on where we would maintain them, and I think you're right, at the highest risk settings we would want to maintain them, but always reviewing the policy over time, and eliminate them in more general public settings, eliminate the mandatory nature of them. We're doing ongoing jurisdictional scans of lessons learned. So we're looking at England, where they're maintaining it in public transit, on the tube in London, for example, and they're maintaining it in their long-term care settings and acute care settings. So we're trying to learn best practices globally and provincially, and as the risk decreases in Ontario, make recommendations to government with that in mind.
Follow up?
Thanks for that. And going back to your comments off the top about wastewater, declining, the signal, the amount of COVID we're finding in wastewater declining or stable. Are you still seeing those increases or worrying levels in certain public health units or certain areas of the province of Northern Ontario? Are we still seeing a rise there, or are those tailing off as well?
Yeah, in particular in the Northeast, we're seeing a rise, and we're seeing stabilization in some of the wastewater settings across Ontario. And I'm learning through that surveillance system, they can break it down by water treatment plant, even within a city. So in Toronto, for example, you could see an ongoing risk in certain neighborhoods in the north of Toronto. So at present, the highest risk areas where we're seeing an ongoing rise in wastewater surveillance is mainly the Northeast, but there are pockets within cities and or within communities where we're seeing ongoing risks. So even though, and this is an important message, Jeff, even though we're reducing capacity limits in certain settings and opening the economy, the risk does remain. We will see ongoing transmission, and the wastewater is a reflection of that ongoing risk of transmission. It's not down to zero in any community in Ontario, but the rates are stabilizing, and our health system is stabilizing and has capacity to care for people who get ill from Omicron. But the risk remains, so please continue, wear your mask, wash your hands, come forward to get your first, second, third, or fourth doses of vaccine because it's not gone yet.
Last question.
From Rob Ferguson at the Toronto Star.
Hi, Doctor. Just wanted to clarify or make sure I understand what you said earlier about when you were asked about masking in schools. You said you would look to remove the masking in the public sector and schools in the same time, and I wasn't quite sure how extensive you meant to be by saying public sector. Could you just give us a little bit more detail on that?
Yeah, so I meant indoor public settings. Outdoors, with appropriate distancing, I wouldn't make any mandatory recommendation on masking. But indoor public settings, depending upon how many people are in a setting, we will be reviewing the recommendation on masking in that environment. And the general feedback from the community members that we've sought feedback from at present is if you're going to lift them in recreational facilities and in other indoor facilities, it just makes sense to also do it simultaneously for educational sector.
Follow up, and this is the last question.
Okay, understood. Thank you very much for that. And I'm wondering, given your answers to Jeff there just a minute ago about, excuse me, about the wastewater indicators, given it's taking place in certain pockets in northeastern Ontario, certain pockets of cities, who is still getting COVID at this point? Is it healthcare workers? Can you just pin it down a little bit for us on what the most risky kind of situations are?
No, I just want to confirm that we're seeing ongoing spread at a community level and across all age groups. It can, from the PCR testing, it remains that 20 to 40-year-old age group. It appears to have higher rates, but it's a biased sample who gets access to PCR. From a hospitalization vantage point, it's the older age groups that are having higher rates of hospitalization, and that's been consistent across the pandemic. If 50 to 60, 60 to 70, the age group risk increases, and that's why it comforts me so much that 86% of those over 70 have gotten their third doses. If we can, I would absolutely endorse more Ontarians coming forward for their third dose, especially if you've got any underlying chronic illness, any risk that would predispose you to hospitalization for COVID-19. Please come forward and continue to get your dose, because the risk is still there in communities. The virus is still present. It's just that the impact on the healthcare system has stabilized.
Thanks, everyone.